Welcome, everyone, to another episode where we strip away the medical jargon to find the logic underneath. Today, we are tackling the foundational bedrock of all anatomy, the anatomical position. It sounds simple: stand up straight, look forward, but it is the compass that guides every surgeon and radiologist on the planet.
That is exactly right, Dr. Khan. While it seems trivial, students often gloss over it until they get tripped up on a Step 1 question. To be precise, the anatomical position is defined as standing erect, feet together and pointing forward, eyes looking ahead, with the upper limbs at the sides and the palms facing forward. If you memorize that exact orientation, you avoid the most common pitfalls in terminology.
Right, the palms forward part is the kicker, isn't it? If you just stand like a normal human, your palms naturally face your thighs. But in anatomy, we rotate that forearm into supination. Think of it like a universal map coordinate system. If we didn't all agree on this 1-0 point, you couldn't tell a trauma surgeon where a laceration is located without creating a total mess.
Exactly. Why does this matter clinically? Consider the forearm bones, the radius and the ulna. If your palms are facing your body, the radius is crossed over the ulna. In the standard anatomical position, with palms forward, the radius is lateral and the ulna is medial. If you don't use this standard, your description of a fracture could be completely reversed, leading to a catastrophic surgical error. That's a great point. It's like being a pilot. If you don't know where north is on your instruments, you're flying blind. And for the students listening, this is the classic gotcha question on boards. They will describe a patient in a non-standard position and ask where a structure is relative to another. You have to mentally rotate that patient back into the standard anatomical position first, or you're toast. Precisely. The board examiners love to see if you can manipulate those spatial relationships. They might describe a patient lying supine or prone. You must be able to translate those positions back to the reference standard instantly. It is high yield because it underpins every directional term: superior, inferior, anterior, posterior, medial, lateral. You cannot master these terms without the reference position. Let's talk about that, because students often mix up medial and lateral. Why does this matter clinically? Imagine you are the doctor of choice for a patient needing a nerve graft. If you are describing the path of the radial nerve, saying it runs along the side is useless. You need to know that in the anatomical position, the thumb is lateral. Therefore, the radial nerve's relationship to the ulna is fixed by that lateral thumb orientation. If you forget the position, you might map that nerve graft entirely on the wrong plane. And remember, the palms forward orientation is what we call supination. If the palms face posteriorly, that is pronation. If you are describing the origin of a muscle or the location of a joint capsule, you must state the position, or the description is technically incomplete. Examiners expect you to understand that the bones of the forearm change their relative position based on whether you are pronated or supinated. It's about language consistency. Think of anatomy like a language. If we don't use the same grammar, communication breaks down. If I say a lesion is above the hip, is the patient standing, sitting, or lying down? Superior is the only word that works regardless of gravity because we have that reference position. That is the academic core of the issue. Directional terms are locked to the anatomical position. Even if the patient is upside down, the heart is superior to the diaphragm. That never changes. It allows us to communicate clinical findings universally. If a radiologist reads an MRI and says the lesion is medial to the midline, that is a standard, unchanging fact, thanks to this definition. So, for the students feeling overwhelmed by the sheer volume of anatomy, don't skip this basic step. It's not just a boring picture at the front of your textbook. It is the framework for your entire medical career. If you get the baseline wrong, every structure you learn thereafter will be slightly misaligned in your mind. I couldn't agree more. Before we wrap up, let's summarize. The anatomical position, erect, palms forward, eyes forward, is the essential reference standard for all clinical and radiographic descriptions. It eliminates ambiguity. If you can mentally place any patient into this position, you can apply directional terms accurately, which is fundamental to avoiding diagnostic errors. Exactly. Nail the fundamentals, keep your reference points clear, and you'll see the rest of anatomy fall right into place. Thanks for listening, and keep digging into those details.